Dr.T.Jayalakshmi, Professor, Department of Genetic Engineering, Bharat Institute of Higher Education and Research, Chennai 73, is going to handle the course Stem Cell Biology. Course code is U18Pege051 and the topic Stem Cell Biology and their application in clinical medicine. Stem cell biology and their application in clinical medicine plays a major role in gene therapy techniques. Stem cells are those cells that have the capability of self-renewal and differentiation. Self-renewal is the ability of cells to multiply without the loss of differentiation potential and also without undergoing biological aging process. The evolving role of stem cells in clinical medicine is developing along at least 3 lines. So there are 3 main properties of stem cells. First one is stem cell as therapy, either to replace cell lines that have been lost or destroyed and also to modify the behavior of other cells. The second major property of stem cell is it acts as a drug targets for gene therapy techniques and also in molecular modeling methods. And the third one is stem cells to generate differentiated tissue for in vitro study of disease models for drug development. The main potency of a stem cell can be defined by the types of more differentiated cells that make the stem cell more stronger. So stem cells can be differentiated into totipotent cell, pluripotent cell, multipotent cell or unipotent cells. So we can see about the various types of stem cells in the next slide. First one is totipotent cells. Totipotent cells is defined as the capability to produce all cell types of the developing organism, including both embryonic and extra-embryonic tissues. The best example for totipotent cells is placenta. And the second one is pluripotent cells. Pluripotent cells can only make cells of the embryo proper, but make all cells of the embryo, including germ cells and cells from any of the other germ layers. Therefore, they can make any cell of the body. And the third one is multipotent cells. Multipotent cells, they can make only cells within a given germ layer. So we know that there are 3 types of germ layers: ectoderm, endoderm and mesoderm. Here in multipotent cells, ectoderm and endoderm plays a major role. So for example, multipotent stem cells from a mesodermal tissue like the blood can make all the cells of the blood, but it cannot make cells of a different germ layer such as neural cells, ectoderm cells or liver cells such as endoderm cells. And the fourth important type of stem cell is unipotent cell. So from the name itself we can see unipotent means it is having a unique cell property. It can make cells of a single cell type. A major example for the unipotent cell is a germ cell stem cell, which makes the cells that mature to become egg or sperm, but not other cell types. So totipotent cells is having first few cell divisions following the fertilization of egg, and the pluripotent cells, they are the cells derived from the inner cell mass of the blastocyst. Blastocyst is nothing but a pre-implantation stage of development occurring approximately 7 to 10 days after fertilization process. And the third one, both multipotent or unipotent cells is having the primitive streak forms in embryonic development from day 10 to 14 post-fertilization process takes place. So there are 3 types of stem cells. The first one is embryonic stem cell, and the second one is adult stem cell, and the third one is induced pluripotent stem cell. So first we'll discuss about the embryonic stem cell. Embryonic stem cells is defined as a typically derived cell from a pre-implantation blastocyst, that is 7 to 10 days post-fertilization process, and it is the most frequent techniques used to derive embryonic stem cells which disturb the blastocyst from which the cells are derived. And the second one is adult stem cells. Adult stem cells, it mainly present in all the tissues and it occurs throughout our life. So it makes the basis for tissue maintenance and it also responds to injury. Tissues where there is high cell turnover such as the blood, skin and intestine forms the major adult stem cells, and a resident stem cell population for some tissues where the rate of cell turnover is very lower. The best example for the resident stem cell population is muscle cells, brain cells, lung and kidney cells. So these are the best examples for adult stem cell formation. So next, coming to the history of induced pluripotent stem cell, it was first discovered by the scientist Shinya Yamanaka and Sir John B. Gurdon. So they first discovered the concept of close relationship between stem cell potential and also stage of development dramatically changed in 2006. So these two scientists got the Nobel Prize in Physiology or Medicine in 2012. So they both got the Nobel Prize for the reprogramming of mature cells. So and the reprogramming of mature cells can be reprogrammed to become the pluripotent stem cells. So their discovery led to the expression of pluripotent embryonic stem cells, but not generally in mature cells, and introduced them into mature cells. So they are especially producing the ectotypically expressed cell. So ectotypically expressed cell or the cell types where the gene is normally not expressed. A small number of the mature cells reverted back to a highly immature cell state, which resembled as embryonic stem cell. This type of process is called as reprogramming cells, which induced a pluripotent state in a previously differentiated cell type, and so that they are named as induced pluripotent stem cells. So the ability to induce pluripotency has changed the landscape of stem cell biology. So it indicates that the state of a given cell, its level of differentiation can be manipulated, resulted in drastic shifts in cell function, and it also leads to the selection of plasticity of the cell, which is greater than previously recognized and can be programmed by specific manipulations to achieve a different cell state. So from this induced pluripotent stem cells, a keratinocyte derived from the skin can also be induced to become a pluripotent stem cell, essentially rewinding the cell's history to revert to an embryonic-like state. Secondly, a cell taken from an individual can also be induced to become a pluripotent stem cell, and it is having the capability of producing or other types of cells in an individual's body. It means, for example, a skin or blood sample obtained from a patient with a degenerative brain disorder can be converted into pluripotent cell. This kind of induced pluripotent stem cell became a source for generating the neural cells affected by the particular diseases. These disease models can be generated using human cells for various disorders by obtaining primary tissue or developing reliable animal models, which is making the difficult one with the help of these induced pluripotent stem cells. And the third one is induced pluripotent cells is having the important property of highly personalized source of cells. So many technologies are developing to generate this type of induced pluripotent stem cells, which are currently evolving in the gene manipulation techniques. And it also used to develop induced pluripotent stem cells, which are genetically identical to the individual. This kind of cells can also be named as personalized cells, and it is used to assess personalized drug therapies and may represent a source of immunologically identical cells, which is used for the transplantation process. Next, coming to the important cell type of stem cell is umbilical cord stem cell. We all know that umbilical cord stem cells can be taken from the placenta during the birth of the infant. So umbilical cord blood cell is otherwise called as progenitor cells, which are widely and easily available, and they appear to be associated with less graft versus host disease than or some other cell types such as bone marrow stem cells. And it is having the important property of human cell leukocyte antigen restriction process, which adult marrow stem cells are less likely to be contaminated with the herpes virus. And the differentiation process of umbilical cord stem cell is unclear because it is having many different cell types which it can be generated, and the methods are also used for differentiating this type of cells is highly difficult because it can be converted into non-hematopoietic phenotypes which are largely lacking in those cells, and the quantity of obtainable cells may also be limited. Sources of stem cells is of four types. So stem cells can be derived from human embryos or somatic tissues in the adult, or they can be created by inducing greater potency in an already differentiated somatic cells. So based on this type, the sources of stem cells are divided into four types: embryonic stem cells, adult stem cells, induced pluripotent stem cells, and umbilical cord stem cell. So in this diagram, we can see the sources or types of different types of stem cells in the human body, mainly the bone marrow stem cell, embryonic stem cell, peripheral stem cell, cord blood stem cell, and also the cord lining stem cell. So in the right hand side, we can see the microscopic 20x view of a colony of undifferentiated human embryonic stem cells, which is having three main sources like embryos, adults, and also the umbilical cord. This diagram shows the human development continuum. So first one is single cell embryo is converted to 3D embryo stage. From that it is converted to 5 to 7 day embryo stage, and the 5 to 7 embryo stage is called as embryonic stem cell stage, which is having a totipotent potency, and then the 4-week embryo is formed. From that 6-week embryo is formed. So this 6-week embryo is called as embryonic germ cell stage, which is called as primordial germ cell stage, and also it is pluripotent. And then fetal tissue stem cell is produced. It is having the property of both pluripotent or multipotent. And then from the umbilical cord stem cell is produced, and it is called as placental stem cells. It is also pluripotent or multipotent. So infant and adult comes under the adult stem cells, which is also having the capability of pluripotency or multipotency. And then from the adult, teratocarcinoma germ cell tumor is produced, which is called as embryonal carcinoma EC cells, and it is having the property of pluripotency. So this diagram shows how the embryo to stem cell is produced. So there are 5 different stages are there. First one is embryo. Here the embryo is, in embryo an egg is fertilized or cloned to form an embryo, which divides to form the 1 to 5 stages of embryo process. In 1 to 5 days, the embryo divides again and again and takes shape as a sphere, which is called as blastocyst. And then the third one, 5 to 7 days embryo is produced. At this time, embryonic stem cells are visible and are capable of developing into any tissues in the body. And then the stem lines are produced. Here in stem lines, the cells are removed and grown in a petri dish. So as they divide, they create a line of stem cells. So this stem line process is an in vitro process. After that, it will undergo the tissue production process. In tissue production, using various recipes of nutrients and other factors, scientists hope to turn stem cells into any of the body's more than 100 tissues, 200 tissues like pancreatic islet cells, which provides the cure for diabetes, and also the muscle cells, which could replace the damaged heart cells, and nerve cells could be used to treat Alzheimer's and also the Parkinson's disease, and it is also used to repair the spinal cord injuries. So human embryonic stem cells undergo differentiation and undifferentiated process. This undifferentiated human embryonic stem cells is converted into differentiated cell types, and also it is used in various therapeutic therapy. So differentiated cell types are neural cells, which is used to treat spinal cord injury, and cardiomyocytes are used to treat heart failure, and islet cells are used to cure diabetes. Dendritic cells can be used to treat immunotherapy. Osteoblasts are used to treat osteoporosis and bone fractures. Chondrocytes are used to treat osteoarthritis, and hepatocytes is used to treat various multiple drug testing. So there are many questions rising that are there different kinds of adult stem cells are produced. The answer is yes, because this kind of adult stem cells are used to produce various cell types like hematopoietic stem cells, mesenchymal stem cells, and also endodermal stem cells. You can see the diagram of this hematopoietic, mesenchymal, and endodermal stem cells in this diagram. So hematopoietic stem cells are used to replace blood cells when they wear out. Mesenchymal stem cells are used to replace bone, tendons, muscles, cartilages when they are injured. and endodermal stem cells are used to replace GIT cells, which is called as osteogenesis, chondrogenesis, and also the tendon repair. So the mesogenic process mainly includes the mesenchymal stem cell, and it is also having four types of process. First one is proliferation, commitment, lineage progression, differentiation, which leads to the maturation process. And the maturation process will produce various type of cells like bone cells, cartilage cells, muscle cells, marrow cells, tendon or ligament cells, adipose tissue, and also the connective tissue. So this type of maturation cells are used to treat bone, muscles, tendons, ligament, cartilages, heart, nerve, hearing cells and other cells which are injured or damaged. And the construction manager include help other cells to build other things and also to control the inflammation, and also it is used in angiogenesis process. So human embryonic stem cells can also reduce swelling and abnormal immune responses. It is mainly used to treat inflammatory arthritis and also the multiple sclerosis diseases, and it leads to the discovery of penicillin in the 21st century. So here the undifferentiated mesenchymal stem cells are converted to committed osteochondroprogenitors. So by producing this progenitor cell, the cells will get multiply, and it is called as proliferating chondrocytes, and it leads to the pre-hypertrophic chondrocytes, and also the hypertrophic chondrocytes when involved in the vascular invasion and also the replacement by bone marrow. So human embryonic stem cells, where do they live? The answer is it can live in a bone marrow, adipose tissue, very few in blood and also very few in joint tissues. They are very rare cells, 1 in 10,000 marrow nucleated cells. 60 ml marrow aspirate yields only 70 to 90,000 stem cells, and it is having the capability of 10 multiplied 10 power 7 to 10 power 8 cells, which is required for therapeutic levels, and it can be grown in lab to yield more amount of embryonic stem cells. So advantages of mesenchymal stem cells include they are highly autologous. It is having no major ethical issues unlike embryonic stem cells, and it can be expanded in vitro. Unlimited supply of therapeutic cells are produced. It does not express human leukocyte antigen 2 because it involves in the allotransplantation possible, because it does not having any cross reactions during the transplantation process, and it is having a strong evidence that it is having the in vitro and in vitro in vivo differentiation process. So we can see the diagram of mesenchymal stem cells in the cultured stem cell. So mesenchymal stem cells involves in the autologous transplantation process. It can be done by 5 techniques. First one is collection of stem cells from the patient bone marrow or blood, and the second one is processing. Blood or bone marrow is processed in the laboratory to purify and concentrate the stem lines. And the third one is cryopreservation. Blood or bone marrow is frozen to preserve it. And the fourth one is chemotherapy. High dose chemotherapy or radiation therapy is given to the patient. And the fifth one is reinfusion. Thawed stem cells are reinfused into the patient. So these are the 5 major autologous transplant process involved in the mesenchymal stem cells. So this pie chart discuss about the therapeutic focus of mesenchymal cells, where it can be used to treat various diseases like cardiovascular diseases in 10.4 percentage, neural diseases in 24.7 percentage. It is used to treat diabetes 7.1 percentage, liver disorders 1.3 percentage, kidney disorders 2.6 percentage. It can be treated as hematopoietic stem cells 16.2 percentage. It is used to treat cancer by giving therapeutic agents as 25.3 percentage, and also to treat musculoskeletal disorders 12.3 percentage. So we can see the color differentiation in this pie chart, which indicates the percentage of disease cure. Next, coming to the general strategies for stem cell replacement. And the first approach is it mainly involves in the direct administration of stem cell. So this may involve injection of the cells directly into the damaged organ where they can differentiate into the desired cell type. And the next one is the stem cells can be injected systematically since they have the capability to home in or damaged tissues by following gradients of cytokines and chemokines released by the diseased organ. So mainly it is used in the various stem cell replacement technique. And the second approach involves the transplantation of differentiated cells derived from stem cells. For example, pancreatic islet cells would be generated from stem cells before transplantation into diabetic patients, and cardiomyocytes would be generated to treat ischemic heart diseases. And the third approach involves the stimulation of endogenous stem cells to facilitate repair. So the drugs are administered into the patient, and after that some other hematopoietic system can be introduced like erythropoietin granulocyte colony stimulating factor and granulocyte macrophage colony stimulating factor. These types of hematopoietic system is used to increase production of specific blood elements, and also it is used to the stimulation of endogenous stem cells to facilitate the repair of tissues. So this kind of stem cells is also used to treat tissue engineering. Ex vivo or in situ generation of tissues is called as tissue engineering process. This type of tissue engineering is used as a vehicle for cellular gene therapy. Here, the transplanted stem cells may exert paracrine effects on damaged tissues without differentiating and replacing lost cells. So mainly this kind of mesenchymal stem cells are used in tissue engineering and also in the regenerative medicine. So clinical applications of hematopoietic stem cells include in 1963, researchers in Toronto demonstrated that a bone marrow derived cell could replace all the blood elements and rescue an otherwise lethally irradiated animal by simple infusion of donor cells into the blood. And hematopoietic stem cell transplantation is become the standard means of treating individuals with hematologic malignancies such as bone marrow failures, including radiation injury, for the past 20 years. In 1975, it was reported that cultured cells from the skin could result in the generation of large number of cells, which is sufficient to provide an autologous cutaneous barrier in patients with severe burns. So we can treat burns also with the help of these hematopoietic stem cells. And the stem cells are now used for bone grafting in orthopedics, and corneal generation from limbal stem cells in ophthalmology is the important application of hematopoietic stem cells nowadays. So hematopoietic stem cell transplant is otherwise called as autologous hematopoietic stem cell transplant, which is used to treat the following conditions like multiple myeloma, non-Hodgkin's lymphoma, Hodgkin's disease, acute myeloid leukemia, neuroblastoma, germ cell tumors, and also amyloidosis. So this kind of allogenic HSCT is used to treat the following disorders like myelodysplastic syndromes, multiple myeloma, non-Hodgkin lymphoma, Hodgkin's disease, aplastic anemia, pure red cell aplasia, paroxysmal nocturnal hemoglobinuria, Fanconi anemia, thalassemia, sickle cell anemia, severe combined immunodeficiency, Wiskott-Aldrich syndrome, hemophagocytic lymphohistiocytosis, inborn errors of metabolism, epidermolysis bullosa, severe congenital neutropenia, square one diamond syndrome, diamond blackfan anemia, and leukocyte adhesion deficiency. So these are all the various type of disorders can be treated nowadays with the help of this allogenic hematopoietic stem cell therapy. So mainly we can treat anemia and also the various types of inborn errors of metabolism and also the ophthalmologic problem with the help of this allogenic human stem cell therapy. So for doing this allogenic hematopoietic stem cell therapy, we need some donors. So the donors should be having some criteria, and it includes the following like identical twin donors, match related donors, matched unrelated donors, mismatched related donors, haploidentical donors, and umbilical cord blood donors can be selected. And preclinical examples using human embryonic stem cells has been successfully differentiated in vitro into multiple cell types for therapeutic uses like oligodendrocytes, pancreatic cells, cardiomyocytes, motor and dopaminergic neurons, and also hematopoietic precursor cells. So it can be also demonstrated in animal models of retinal blindness, Parkinson's disease, Huntington disease, spinal cord injury, myocardial infarction, and also type 1 diabetes mellitus. So the clinical use of human embryonic stem cells, mainly having the 99% cure in retinal pigment epithelium therapy. So in 2012, the first report of the safety and tolerability of human embryonic stem cell is used for the treatment of two patients with which is having retinal disease appeared. So one patient with dry age-related macular degeneration, and the other patient is having this Stargardt's macular dystrophy. So these two patients are compared, and the clinical use of human embryonic stem cells were derived from them. So human embryonic stem cell differentiation resulted in greater than 99% pure retinal pigment epithelium, of which 50,000 retinal pigment epithelium cells were injected into the subretinal space. So after that, proliferation of this RPE takes place, and both patients were treated with low dose tacrolimus and myophenolate mofetil for immunosuppression beginning. So after giving these type of immunosuppression drugs 1 week before the procedure and continuing for 6 weeks, followed by 6 additional weeks of mycophenolate mofetil only. So they are having no signs of rejection noted during the follow-up. So this improvement in the visual acuity was noted in both the patient, and this is the successful clinical trial of human embryonic stem cells which can use to treat retinal pigment uh, epithelium in the ophthalmology field. So these studies permit testing of basic principles in a physiologic setting and therefore conclude that murine models of human diseases can also be generated by using these embryonic stem cells. So for two such models, Parkinson's disease and hemophilia A, we can use this induced pluripotent stem cells which have been generated, and it is used to differentiate cells that could be transplanted for gene therapy techniques. So by using this induced pluripotent stem cells, other technologies can also be developed for gene therapy. It is used to create gene-corrected cells for transplantation, and also it can be used as a principal study model for mouses, which can use to treat sickle cell diseases, and where the mouse produces hemoglobin genes contained in the mutations known to cause sickling in human sickle cell anemia. And sickle cell anemic mice improved the disease phenotype. So this represents a model for the use of induced pluripotent cells as gene therapy in the setting of genetic disorders. Challenges takes place in the clinical use of stem cells as replacement include tissue integration, oncogenesis, directed differentiation, and the last one is uniformity and consistency. So the first challenge by using this type of hematopoietic stem cells are it can having the tissue integration process. So the first issue is how transplanted cells will integrate into surrounding tissue to achieve a physiologically beneficial effect. This is of particular relevance where coordination of complex networks of cells is essential, such as the heart and brain cells, where aberrant circuits can result in serious adverse effects. And the second concern is oncogenesis. In oncogenesis, it is the potential property for transplanted cells to form tumors. And though it is having the pluripotent stem cells, they are used to form the teratomas, which is called as neoplastic tumors containing cells corresponding to all three embryonic layers in animal models like ectoderm, endoderm, and mesoderm. Evidence also suggests that oncogenesis is not restricted to pluripotent cells. So the culture process may enable the outgrowth of genetically abnormal cell types, which could be potential danger. So this type of stem cells can be used to treat the pluripotent stem cells to assure genetic integrity of transplanted cells, which is an active area of consideration. So the third one is malignant potential cells, which is the major concern of induced pluripotent stem cell. So this method is having the greatest efficiency for reprogramming cells, and currently retrovirus or lentivirus based, and it is having the risk of mutagenesis by virtue of viral integration into the host genome. And some of the genes are used to induce reprogramming, genes called as oncogenic potential. The example is CMYC gene, and progress in reducing the number of gene products needed for reprogramming, and in the use of either non-integrating viruses or small molecules to supplant retrovirus-based reprogramming is ongoing. So this type of developments can mitigate the concerns about the insertional mutagenesis, but it will not entirely assuage concern for altered growth control of modified cells, particularly those with pluripotency. So other clinical applications include disease modifiers, drugs targeting endogenous stem cells, and the disease models. So mainly the sources of stem cell banking include umbilical cord, menstrual blood, and the dental pulp. So this diagram shows how the cord blood is collected from the cord lining. So first one, soon after the delivery, the cord is clamped but cut and child is separated. So we all know about this type of cord blood collection, which is taking place in many hospitals nowadays. So the cord blood is then collected into the blood bag, and once the cord blood is collected, 15 centimeters of cord lining is cut and inserted into the conical tube. The collection should be done within 10 minutes after delivery, and it does not involve the mother or child. The collection is done by the obstetrician or the nurse. So we can see how the cord blood is collected by using the cord lining connection. So this CryoServe is the company which is giving all the collection process units like CryoServe human cells for storage. You can see the diagram of cord lining tube and a cord blood bag, and also the maternal blood sample tube here. So in this chart, we can see the various Indian hospitals offering stem cell therapies. So first one is AIIMS Delhi. Their area of specialization is cardiac, neurosurgery, vascular surgery, diabetes, ophthalmology, and cancer. And the second one, Christian Medical College, Vellore. Their area of specialization in stem cell therapy is cardiac and diabetes. So LV Prasad Eye Institute, ophthalmology department. Tata Memorial Hospital, they are having the cancer stem cell therapy. Manipal Hospital, Bangalore, they are having the stem cell therapies for cardiac, ophthalmology, neurosurgery, vascular surgery, diabetes, and cancers. And Lifeline Hospital for cardiac, and Apollo Hospital for cardiac and cancer. So these Indian hospitals are mainly offering these stem cell therapies in various areas of specialization. So the next important property is ethical considerations. So while we are using adult stem cells, embryonic stem cells, and induced pluripotent stem cells, we are having more ethical considerations. So the initial and most frequent technique to derive the embryonic stem cells disturb the blastocyst from which the cells are derived, raising concern that an early human life forms was being destroyed. And this type of controversies led to the policy decisions among some nations that pre-included embryonic stem cell research, or as in the case of the United States, federal funding to support such research. So when we are using this induced pluripotent stem cells, it mainly having some less ethical issues, and it is having the alternative source of pluripotent cells. So it should be recognized that IPS have not yet been shown to be fully equivalent to embryonic stem cells, and embryonic stem cells still represent the best defined pluripotent cell population. So instead of using this adult stem cells and embryonic stem cells, we can use this induced pluripotent stem cells because it is having very less ethical considerations. Stem cells have enormous potential which can be well recognized by the public, and they are the source of hope for those dealing with otherwise untreatable medical problems. And though it is in the state of infancy and progress is painstaking for those desperate to get help, unproven therapies even outside of reputable centers or clinical trial are a highly tempting option. And the potential for patient exploitation rises another extremely challenging area. So though this type of stem cells is having more ethical considerations due to its more infancy stage, and also it is having more cure, they should be produced in a more amount, and the patients and providers should ask a range of specific questions about these such therapies. And the International Society of Stem Cell Research, ISSCR, has provided suggested questions and other information which can be used to the public and also the researchers. So if you go to this website www.isscr.org, so we can find more types on the applications of stem cell and what are all the recent stem cell research going on by the scientists. So though it is having more ethical considerations, so the differentiation process makes it most feasible that the stem cell can be used to treat various multiple disorders. Thank you.